My name is Amanda Sergesketter. I'm one of the 2024 PRS Journal Resident Ambassadors, and I'll be discussing the article entitled Autologous Breast Reconstruction Success Rates in Hypercoagulable Patients, published in this month's PRS Journal. So the background of this article is that hypercoagulability is a known risk factor for adverse outcomes in microvascular flap reconstruction and may even be considered a relative contraindication to autologous breast reconstruction by some surgeons. Hypercoagulability in general may be separated into two entities, including patients with a history of a thrombophilic disorder, as compared to those with a history of a prior thromboembolic event. And the authors aim to compare outcomes of microvascular breast reconstruction between these two patient cohorts. To do this, they performed a retrospective review and identified 101 total patients undergoing breast reconstruction with preoperatively identified hypercoagulability, including 23 with a thrombophilic disorder and 78 with a prior thromboembolic event. The authors found that while free flap success rates are over 90% for all patients, the rates of early flap success were lower among patients with a history of a thrombophilic disorder at 92%, compared to patients with a history of a prior thromboembolic event or in patients with no known history of hypercoagulability, in which flap success rates were over 99%. So overall, this article shows that microvascular breast reconstruction may still be undertaken among patients with preoperative risk factors for hypercoagulability, though the lower relative success rates of free flap breast reconstruction among patients with a thrombophilic disorder highlight a need for additional preoperative counseling in this population. Overall, the authors are to be commended on this study, as it has the potential to improve the safety and success of microvascular breast reconstruction among breast cancer patients with known hypercoagulability.